Become emergency 911 with the address of the emergency. I need emergency! My husband is dying! My husband is dying! Come 911 to me now, please! My baby's not breathing! Okay, now, are you with him right now? He's not breathing at all! We all are with him! Oh, please, just somebody, he's dead!
It's the AEMT lecture series. My name is Mike Morse. Welcome to chapter number 2. Dive right on into it. Chapter number 2, all about its title, really. It's workforce safety and wellness, and that's what the chapter is about. And so, the heart and soul of the chapter is really it's about a few things. One, staying safe when you're dealing with bloodborne pathogens. Death and dying, how to present yourself on a call where someone who family member, loved one, etc. has died, and prevention of injuries, not just physical injuries, but the mental stressors that so common in our job sect. So let's go through some of it and see what the chapter has to offer. Get a cup of coffee, pull up next to the old computer here for some old family fun. We'll try to get through this chapter rather quickly. Nothing new really from your EMT training to your advanced EMT training in this area, but it's a refresher nonetheless. You could see questions on the registry exam, on your exam here, that pertain to this. Every class that you move up in, really what you're doing is becoming a better EMT. You go to paramedic school, it's the same way. It's the same type of getting started off the ground, review stuff. Okay. So when we talk about the suffering of others and how to deal with that, we all come from different backgrounds, different raising, different ethnic groups, and it's some things that you may find in your group that's appropriate to say, it may not be appropriate to say. I think a lot of that comes with just experience on the job and learning what's appropriate, what's not appropriate, and that sort of thing. Sorry, my voice is kind of scratchy today. Trying to try not to make it too bad for the listening audience. Okay, infectious diseases. This is the era for that for sure. Just some definitions that you need to be aware of. Organisms that cause disease. Okay, they're known as pathogens. Okay, let me get my pen up here. Something you need to be aware of. All right, so organisms that cause disease. All right, so they're called pathogens. All right, so these pathogens, all right, or organisms that cause disease are called pathogens. Okay, so they can be spread from person to person or from one species to another. So what can we do to protect ourselves, right? So one is immunizations. So some of these immunizations are, there may be like a series. Okay. And some are actually annually. And an example of an annual immunization that we should get every year. And some places are actually making that mandatory. I mean, they're taking you off the schedule if you don't do it. All right, is your flu shot. All right, so protective techniques. And then we get introduced to standard precautions. And we're going to talk about standard precautions and exactly, what standard precautions are about. So I like to think of it, sometimes when you go out, you may go to a formal event. Well, there's formal wear for that. And then you may go to something that's not so formal. It may be business casual. So that's kind of like standard precautions is. But the definition to be aware of standard precautions is just the practice of protecting yourself from disease and transmission through exposure to blood and other body fluids. But this is your single best technique. All right, Your single best technique to prevent the spread of infection is just washing your hands. Okay, wash your hands. That's the biggest thing that we could do as EMS providers. And you notice I didn't say use hand sanitizer. I said wash your hands. And hand sanitizer has its place. Perfect for, you're clearing up a call, you have nowhere to wash your hands. Yes, absolutely. Hand sanitizer is wonderful for that. But when you can get somewhere, the single best technique you can do to prevent the spread of infection is to wash your hands. All right. Moving right along. Oops. All right, so signs, and we'll talk about signs here in a second, but when we're talking about proper cleaning and disinfecting of the ambulance, right? So the reason why that's so important is, let's say that you have a call, and we're going to say that, and we say ambulance, but in our case, it could be our jump bag and our O2 bag. Make sure that all of that's cleaned up, because say you have a 4x4 bandage, and let's say that AMR is gone, right? And there's some blood on that bandage. Okay, blood on the bandage, and you're cleaning up, and maybe you've taken your gloves off or whatever, or maybe it got on the jump bag. And what happens is hepatitis can transfer from wherever that blood is, can transfer over to you or the host. And you would be the host in this case. So there you go. So that's why it's important to make sure that we wipe everything down. So let's, and we're habit creatures. So irregardless of what kind of call it is, if you just get into a habit of wiping it down every call, then a lot of times, it'll go well for you. You'll be in a good healthy habit of cleaning up. And that's what this chapter is about. It's about preventing us from catching somebody else's stuff. All right. And then the signs part is, a lot of times, we need to make sure that we're giving a good report to the off-going EMS crew. Off-going, my God. To the EMS crew maybe that's picking our patient up, right? So they come in, we need to give them a report, but that report should include, histories of, HIV, hepatitis, and, infectious disease type history, right? We should always be dressed for the occasion. And so in case that information doesn't get to us, we treat everybody as if they had something, but it's a good thing to do. And also, like even in the hospitals, for positive flu cases, they're hanging signs on the door, and they're saying, like the positive, patient's positive for flu, whatever. That gives people an idea before they just go bouncing in there that they need to mask up, because immunizations, they don't prevent. I mean, hopefully they'll prevent 100%, but immunizations were not intended for 100%, coverage. It's great if it happens, but even if it's 80% or 70%, so you still may catch the flu, you still may get it, but hopefully it won't be as bad as if you didn't have the protection from an immunization. So that's what they're all about. Actually, some of the stuff you're going to see on here, I'm redoing this lecture. And the reason why is because I listened to myself a little bit, and it sounded it was terrible. I mean, this chapter isn't the exciting chapter, but at the same time, it was pretty rough. So probably like this one is now, but this one might be a little bit better. All right, so when we're talking about routes of transmission, right? How does this stuff get through? And what you'll notice too here is it's confusing as they could make it when we're talking about all contagious diseases are infectious, and you're like, okay, I got that part, but not all infectious diseases are contagious, and that's kind of where it kind of throws people for a loop. So I want you to think of it like this. So let's say somebody aspirates, right? And they aspirate food or liquid, and it ends up in the lungs, and that's a perfect breeding ground for bacteria because it's wet, it's warm, it's a good place for the bacteria to attack or to be. And if something foreign comes down there, chances are really good that you're going to develop a pneumonia, right? And so with a pneumonia, it can become a bacterial infection. Now, it's infectious absolutely to the person, but it may not be spread to somebody else. So even though it's infectious, it's not like a contagious type deal. All right. Then we're going to talk about how this stuff gets moved, spread. So direct contact with blood, most definitely. Indirect contact. So indirect would be, I didn't get it on my skin, but I got it injected into me, like a needle stick. Airborne would be sneezing. Foodborne, contaminated food. And then vector would be like your mosquitoes, fleas, stuff that come from animals. Just a review. Shouldn't be too difficult right now. Just a lot of, stuff that you probably forgot and just need to refresh. All right, so what I mentioned earlier about certain outfits for certain circumstances, right? Assume every person is potentially infected. And so there should be a question, just, like you have an OB patient, she's in labor, and, she has HIV, I think was the question. And the question was, it was kind of confusing, but it was trying to take you down a road of you should do something different for the patient, and really you shouldn't, because we should treat every patient as if they had an infectious disease. All right, so assume every person is potentially infected. If you become exposed, then you need to notify your infection control officer, because every department has an infection control plan. Every one of them do. And so yep, so no, that's a slide that's upcoming here. Just let me get over there to it. But I'll cover it when I get there. But yeah, so gloves are the minimum. Okay, they're the minimum. All right, so when we're talking about standard precautions, all right, the minimum. So everybody's getting that. Okay, then from there, we're going to move up from there. So I think we have slide upcoming. All right, so here we go. So eye protection. So we're going to wear eye protection whenever we feel like there's a potential for splatter. Okay, so anytime there's a potential for splatter, suctioning, intubation, putting an advanced airway in, that anytime you have a potential for splatter, standard protection then will include eye protection. All right, so what about gowns? So gowns are, they're for extensive blood splatter. And so we're going to use those with other PPE, right? So the only thing about gowns are, and that you need to understand is, they're very cumbersome, and they can pose a risk for injury. So it's not practical to wear a gown, right? Unless you have something going on. You have an OB delivery, delivering in the field, a major trauma where there's blood everywhere. Okay, so gowns aren't appropriate always, but sometimes they are. And then we talk about the mask, right? So mask, there's the standard surgical mask, and then there's the HEPA mask. So surgical mask is when you're dealing with some type of mechanism that would include spatter. A surgical mask is fine if your patient has some type of communicable disease, like potential for the flu. That's a good time to throw on a surgical mask, right? But if we're dealing with someone that has signs and symptoms of TB, then we're going to have to break out the HEPA mask. Make sure you dispose of your needles properly. Here's the infectious disease policy I was talking about. Everybody does what we do has one. Okay, so if you have questions about the steps to take if you become exposed, you need to check your infectious disease policy. And if you're still confused, call the infectious disease officer for advice on what to do. A routine, I mentioned that earlier, we're creatures of habit. So a routine is going to help protect you. So here we talk about lifelong immunity. Okay, so lifelong immunity and what that means. Let me erase that for a second. All right, so lifelong immunity. All right, so lifelong immunity. We're going to use rubella. Good old rubella. You know who rubella is. All right, so rubella is AKA the German measles. All right, so good old German measles. All right, not to be confused with the measles, because they do share characteristics, right? But they're not the same. Okay. If you have been, before they had vaccinations for this, if came in contact and had it, then you would have lifelong immunity. You're not going to catch it again. It's a one-time deal. Okay. So that's an example of that. So immunity comes from having been immunized or vaccinated, or you recovered from that infectious germ. All right, sometimes immunity is only partial. If you didn't get a good dose of it the first time, there might be a round two. And some diseases we can't form an immunity to, like, some bacterial infections. But remember what I said, like flu shots or other immunizations, they don't provide 100% protection. Okay, so that's not what they're designed to do. So get your flu shot and stop whining because you think you got the flu after the flu shot. I don't care. Get your flu shot. It's better than getting the flu. You heard it from me. Yes, you did. All right, so preventative measures, get your flu shot and stop crying about it. That's all about that pretty much. Make sure you take care of yourself. Get your PPDs. Maintain your personal health. What about this? So hang on a second. So what about this? So we have a scene call here. It's at night, obviously. I think those are flares, but we don't use those anymore. But we don't anyway. However, we need to make sure we're putting on the traffic vest. And the obvious answer, it increases your visibility. Sorry, not your visibility, but the visibility of passing drivers. See that again. Okay, so make sure that you put the vest on. It's going to increase your chances of not being hit when you otherwise would have been hit. And then your DOT has emergency response guide. It should be on every unit so that you look this stuff up before becoming exposed. And some of it's common sense, but I understand scene calls. I know where they become chaotic and things go bad, but we have to manage the chaos. And we always have to put ourselves and our safety first. Our families expect that. We want to go home tomorrow. Okay, yeah, so moving right along. I had to pause you there for a second. I hope I didn't lose you mid-sentence. I don't think I did. But so here I want you to notice something. Let me erase that so I could redo it. All right, so when we're talking about fire and hazards, carbon monoxide is a major problem, right? We should know this. But carbon dioxide should not be, okay? You have to read it careful. You'll know what I mean when you see the exam. What about scene hazards? Oh, hang on a second. What about the scene hazards? So, scene hazards, some things you need to know about. Always, always, always. So you're approaching the scene, right? You got somebody who's sitting, maybe they're sitting on the curb or wherever they're sitting. It doesn't really matter. As you approach, you need to start talking, all right, to the patient. And always be prepared. All right, for the patient to become violent. And hopefully you give yourself enough room in between so if they become violent, you can escape. How about that? How about that? At least you can pause me and you can go like stretch or do something. If it gets too monotonous, I'm just trying to just cover the highlights here, okay? So, let's see here. And something else to understand about is burnout. Sorry guys, one more interruption there. So when we're talking about burnout, we're talking about what is the effects of burnout. So it can diminish the EMT. If you want to put A in front of it, you can. Ability. All right, to provide competent care. All right, remember that. Remember that. Okay. Yeah, I think that might be it that I have for this chapter. Oh, I got a little more. Just a little more. We're almost done. Sorry, but I'm not sorry either sometimes, Sorry, but I'm not sorry because I had to go through it too, so it'll get better. All right. Sure. Wellness. Take care of yourself. Take care of yourself. Take care of yourself. All right, here we go. Death and dying. So when somebody says, not me, okay, so that's going to be anger. Okay, that's going to be anger. If you miss it on the test, I'll know you didn't listen to the video. All right, so when you're working with family members, and you're in a cardiac arrest situation, somebody's like, oh my God, are they going to be okay? Are they going to be okay? Just provide them with what the factual basis here is. So right now there's no pulse and they're not breathing. All right, we're doing CPR and everything else that we can do to save their life, right? I mean, don't give false hope is what I'm saying. Because I did that one time on accident, and it did not go good. But in my case, I had a lady who who had been discharged from the ER for food poisoning, and she goes home and she's still vomiting. So they call 911, and so we get there. And I was like, we're gonna make her feel so much better, no problems. And the family's like, oh, thank you. And I said, hey, she's gonna do great. We'll see you back at the ER. And they said, okay. And I told them, I said, take your time. Don't rush. Everything's going to be okay. We loaded her up. I gave her, at the time, we were giving Phenergan for nausea. Gave her some Phenergan. She just started becoming combative as all get out. And I thought, oh my God, I knew it wasn't an allergic reaction from the Phenergan, but, I didn't know what was going on. Sure enough, she ends up having a huge, a huge head bleed, and she was dead before the family ever got there. And I bet there are some EMS hating people right now. So, but yeah, you never know. You never know. Just like when you're doing CPR on somebody you think's dead, you never know. You might get them back. So that's all I have for chapter 2. Okay, chapter 3 is coming up next, and I will see you then.